and now I'm going to discuss how mindfulness can specifically impact a physical therapy evaluation or treatment that may be beneficial. So, information regarding change in symptoms is extremely important when performing an evaluation. And again, as I said before in previous videos, the more objective that you can be through mindfulness, the better the results, the better the information. So these changes that take place specifically during an evaluation are very important, and if you can do so without having quick judgment or a quick reaction to that pain, that is better. You can be very specific in what you're experiencing and relate that information to your clinician. For example, location is so important, especially when dealing with spine-related conditions. So if you can note exactly how you are feeling and what you are feeling before you perform an evaluation technique, during an evaluation technique such as a movement or a posture, and then how you felt afterwards, this information is extremely helpful to the clinician. It's also good for you to feel it and recognize what is taking place there. When you're being mindful, you're going to understand it better. You're going to get a better handle on it. And when that is done repeatedly, it gives you, as the patient, more information. And this is really what's important here, is that evolution of your symptoms from the before state to the during state when you're performing a movement or exercise, and then after. The focus is on the present sensations, what you're feeling right at that moment. Mindfulness is all about that. It's not about thinking about, when you're out and about, when you're sleeping, or that information will be asked at some point. When the clinician performs what we call a subjective assessment, when they ask you some questions about the nature of your pain, that information should be relayed at that time. But if you're in the middle of an evaluation technique, you've just performed some sort of movement, now is the time to be fully present with what you're feeling. Mindfulness is a vehicle that allows that to happen. It allows you to understand and feel exactly what is happening right in front of you. That experience of being very objective and very present with yourself gives you a better chance to understand the cause and effect relationship of specific types of movements and posture on your condition. The goal of the therapist, the clinician, is to discover what is the cause and effect relationship regarding your symptoms when you perform certain movements. Are there movements which cause you to get better, to feel less pain, to be better afterwards? That is so important. And so the clinician should be focusing on getting you to recognize that in yourself. That is the ultimate form of patient education, is proving to the patient through their own movement that they can get better, and this is the way how to do it. And so that should be very clear and straightforward if possible. The human body is complicated, and so are pain conditions. However, if the clinician can show you very clear and straightforward ways to do this, it can be done through mindfulness. When you are mindful of what you're experiencing throughout the entire evaluation process, and there is a movement or a posture that is found to help you, that cause and effect relationship should be emphasized so much, and you should be there ready to experience it and understand it. And this is how mindfulness can have a huge impact on the success of your physical therapy treatment or evaluation.